What is it? In 2015, there's this article looking at two CAD/CAM contour zirconia crown systems and lithium disilicate. They found that the mean marginal gap of lithium disilicate glass ceramic crowns was significantly lower than that of CAD/CAM anatomic contour zirconia crown systems. And again, they were looking at shoulder and deep chamfer preparations. If we look at this article from University of Iowa in 2013, looking at internal marginal fit of pressed and CAD lithium disilicate. So we're looking at CAD/CAM versus a pressed type of lithium disilicate. They found that they looked at impression techniques as well, PVS versus a CAD type of technique, and they found that PVS with a pressed ceramic gave you the best marginal seal. The marginal gap was 0.03 versus all these other ones, which came in at 0.07. So how do I prepare my crowns? Basically, I do my gross reduction with a chamfer type of burr, use a football for occlusal reduction, and then I go in with a flame type of diamond to do my finish line. And to do a lingual reduction, I'll do a football as well. And I always like to temporize. I always like to make sure that my temporary fits ideally as well. This quote from one of my mentors, Dr. Amsterdam, stated the only difference between the temporary crown and the permanent should be the material from which it is made, which means that the contours of your temporary should match as ideally as possible as your permanent restoration. So here you see the same patient on the top. That's a temporary molar, and this is the permanent molar. Okay, you see the good tissue contours, good tissue color, and marginal adaptation. I like to use the NexTemp cement when I do cement my temporaries. Typically, I prefer to do the preparation and temporization on one visit and do the impression at another visit. If that's something that you can't do, then do your best to try to get good hemostasis. The reason I like to use the NexTemp is because it's a non-eugenol based type of temporary filling. Temporary cement, has fluoride, has also potassium nitrate and chlorhexidine. So when you use this temporary cement and you take it off the next time you see the patient for your impression, you'd be surprised at the tissue tone that you find. I will also recommend when you use this temporary cement that as soon as you seat your temporary in there, clean it off with a microbrush. When this thing sets, it sets really hard.